sick, and then you have the familial factor, and then you have all these cases that were somehow together, and then that social gathering is over and they'll all get off at the same time, if that makes sense to you.
Yeah, it makes a lot of sense. Sure it does.
Okay, can I
Yes,
ask, is there were, what we heard was 6 people that they had who could come help, and then those 6 people didn't materialize. What was the reason? Did they change their mind, or what was the situation?
I had 6, and then the one person dropped before we really did much. Said it was just overwhelming. And then I had 5. 2 of them, they had family members got sick. One of them got scared off because of the fear factor of the using, talking to people that might be angry at her. And then the other 2 I still have. I have the interpreter and I have the physician's assistant. I was sure when we were going to take them that it would work, but I think it was a lot of commitment and there's liability involved. The one other lady was a retired nurse and she just, it was so I think I had a list and I heard this. That was all the people that I knew. I don't have any more people.
apparently what was not. Dan, we missed a bunch of that, but basically what I hear you saying is we had 6 and we now have 0. Is that correct?
No, we have the interpreter who she was hired for interpretation only because she's not medical, and we have a retired physician's assistant. So of the original 6, I do have 1 is contact tracing, 1 is available for interpretation.
Okay, the interpreter, was that somebody already on staff or is that a new person?
That was a contract that from Paul's efforts to get the people paid.
I guess my question is it Nancy Molina or did we hire somebody else?
No, it's an outside person, Sylvia.
Okay, so we have an outside interpreter and that person's still available to us?
Yes.
Okay. And you have 1 physician's assistant
Yes.
that's available? And
he's doing a fine job.
okay, and that physician's assistant's authorized to function as a as a health professional?
Yeah, active medical license.
Okay, so that person can make initial contact and get confidential information?
Mm-hmm. That person, the way we've been doing it, we have found that rather than handing the person over to another caller, we'll just have the initial interviewer follow the family until the duration is completed. That's the factor is knowing if that person talking to them from start to finish.
Okay, I understood that we were going to use current employees to do some of the follow-up contact tracing and contact with the families. Is that true?
I think we ended up just assigning Ida and Kaylee. They just do the initial call. I can't say for sure because we don't the way I thought it was happening.
Okay.
They just get their assignments. They were getting their assignments from Paul and was doing the calling. We just
I'm a little confused, Diane. As I understood it, the initial contact where a medical professional is required to gather the necessary information was to be done by a medical professional. In this case, you are the physician's assistant now that Paul is gone. And then that the follow-up could be done by current office staff whose duties would just be reassigned so they could do that. Did that actually take place?
No, what we've been doing, I think, I'll have to ask Ida and Kaylee, but I think they have just been, we've looked at the Cedars list every day, And if it was a case that wasn't a high-risk case, like a elderly person or a baby, or they have been taking like young cases or people of age. That's what I think's been happening.
Okay, so that Paul was handling that at the time, basically.
Yes.
Okay.
And what we did was we just, each day on Cedars, we just looked at who was there and people were assigned. I did discover just over this weekend, kept bothering me why our Rio Grande list was always off from the regional list. And it's because they were assigned, but nobody remembered to put them into the Rio Grande Confidential. So I think I've got it pretty close to matching at this point. But I'll take it upon myself from here out to be sure that whatever person gets assigned to that case will be on the confidential that they're lost, in the confusion. Because one person will be doing the Rio Grande Confidential. That's going to help.
Okay.
Keep us
Our
on track.
understanding when we had the staff meeting after Emily left, and we had a staff meeting that following week, and we had the discussion, that's when we were told about the potential of having 5 or 6 people come on board to assist, that Paul indicated to us that he was able to use current staff for some of the less confidential type things, just the routine follow up, that they would have a questionnaire checklist or something of that nature that they could go through just to do whatever it is that follow up contact tracing entails. Uh, if I'm hearing you correctly, that did not happen.
You'll have to ask Ida and Haley how they got assigned their cases. I just don't know how it happened. But I've done over 45 cases, and I can say that the initial interview really doesn't end the medical uh, problem solving and troubleshooting. Each day you call, a person could get sicker. Um, each day you call, they have questions for you. And so what might happen is the person who is doing the higher level part of the investigation might end up doing 3 times the work than just doing it themselves, because the person doing the lower level investigation has to ask you all these questions anyway. So the way I think is best is determine if the case is high risk or low risk. And if they're high risk, they would hand them back over to me anyway, and keep them doing people that have mild symptoms and are getting better rather quickly. Because I've had people ended up going to the hospital twice. I just don't know if our non-medical people would be able to handle that kind of interchange and know which state and know how to help the family to prevent a COVID death. Just to be kind of straightforward. That's our worry, that somebody might not go to the hospital and they might die. So I don't know. That's just, we didn't really talk about. We just were doing. Each of us was doing our case follow-up.
Okay, and this is not a criticism. I'm just trying to get information because, to my knowledge, the Board of Health was never given a clear description of what public health's role in this was, as it in referencing individual cases. I would assume that if somebody's been diagnosed, the primary care physician would be the one to determine whether or not they need to be hospitalized or they could stay home and self-isolate. Correct me if I'm wrong on that assumption.
It happens too quickly. You basically are their lifeline for COVID. Matters. They have referred to their physician like for oxygen supplementation and stuff, but like the physician may not get back with you at 9 o'clock at night, so the contact interviewer is just like, we need you to go to the hospital tonight. Don't wait until tomorrow to talk to your physician. we need you to see somebody at the emergency room. That's kind of, because when people get sicker, it happens very, very quickly.
Yes, I
We all
understand that.
are, not like the physician, but that's why the contact tracer should be medical, because you are giving them, you know, that type of recommendations. So you want to get it right.
Yes, I understand that also. If you had a measles outbreak, and public health would certainly be involved in that, but at what level would they be given individual advice in lieu of what they would hear from a primary care physician?
It wouldn't be as involved as this. The reason we're so involved with COVID is just it's just such a you deteriorate so quickly with measles. You know, you get sick. What we would be doing with measles is our classic investigated response, and you just keep them home, check in with them, and answer any questions they have about measles, and then any medical questions they might have about fevers, whatever, coughing, watery eyes, whatever. They would get the information from their doctor. But
Okay.
COVID is kind of a different animal. There's
So,
so much circulating that the doctor is only there. The doctor is only there sort of to help with oxygen supplementation and things like that. Attending physicians are really the ones that are handling COVID, the hospitalists.
I think part of our confusion is it sounds like public health generally is neither staffed to handle this kind of situation, and there's a lack of clarity on how people actually get their advice and get medical treatment. Because you're doing all this over the phone, so you're not taking vitals or anything of that nature, and probably not really capable of making a definitive diagnosis. So you have to go off self-reported symptoms to recommend whether or not they get into the hospital. Would that be correct?
Right, and I can say that of those 45 or so, only a quarter of them have gotten seriously ill. Most people, the reason we are calling is to just encourage them to self-isolate. Don't have anybody come over. You tell them that every day. They're much more likely to do it than if, you told them once.
Sure. But it
So,
wouldn't take a healthcare professional to give that advice.
no, but that's the quandary is we don't know who those 25% of the total caseload are going to be that are going to actually need some pretty serious recommendations and not just stay home and don't have visitors over or go anywhere. We don't know who those 25% are. And
All right.
if it happens at 7 o'clock at night, that contact tracer, I guess, could call me, but that delays getting people to the hospital. It's just, it's there really is no roadmap for COVID. It's kind of odd. It's a lot. If you had to compare it to anything, it's like tuberculosis. Just every case has its unique problems.
Right. It would seem to me, generally speaking, if people are getting worse, having uh, the aggravated symptoms, such as I think the one that really affects people is the breathing difficulties. That seems to be the one we hear about the most, where
Mm-hmm.
people notice that. Under normal circumstances, they would just go to the ER, make that decision themselves, rather than calling an intermediary to get that advice. But in this case, we have a structure where, for some reason, they're calling into the public health department. And as I understand, we're not staffed at 7 o'clock at night, right? We're not at our desk. So we're not in a position to respond then anyhow.
But the family that we're working with is encouraged to call us or call the hospital emergency room. With COVID, another big reason we are talking with them is to just do not go to your doctor's office, do not go to the emergency room without telling somebody you are positive for COVID. We don't want them just going into a waiting room. So they may not remember that unless we remind them.
Okay, I would think that the healthcare facility would have ways of dealing with that. I know when I've gone in for just routine appointments, they've been very clear with signage and what have you that I'm to report if I have any COVID symptoms. So I would assume that end of it could take care of that rather than us having to remind people. My concern is this, Diane, we have to figure out how to staff and pay for all of this. And we were having difficulty. We thought everything was handled, and we were not apprised that there were any challenges coming up, nor were we given uh, a definitive description of how the process was working.
I
Uh,
can provide, I do have a fact sheet that I can provide everybody. It's just sort of the, basic um, criteria of a contact investigation. It's just a fact sheet. Would that be helpful?
I don't know. It might be. It certainly wouldn't hurt. But our challenge right now is our public health director walked off the job, didn't give us the information we needed so we could clearly understand how to staff. And so when we go out and advertise for more staffing, whether the contract or regular employees, we're not really sure what we're asking for. We get these general, we need a public health professional. What does that mean and why? Some of this is kind of like we are getting in between the patient and what would be their normal health care options and giving them advice. But we're not necessarily giving them medical advice, as I understand. We're basically saying get to the doctor or stay home and isolate. And so it's an ill-defined role.
I'll just give you, and this is confidential, of course. I'll just give you a scenario. Um, the person was living with the children of the household, the adult children, and the person just kept saying, "I don't have to go to the doctor. I don't have to go to the doctor." Well, about 7 days in, that person was flown out of here. So if somebody is talking with the family, the caregivers of that case, it helps them, you know, it helps them um, save a person's life because they'll be listening to a trusted person to say, don't listen to the case. You need to do what is essential. Take them to the hospital today, tonight. People just, I don't think they understand the severity of COVID and that it can kill you. Confidentially, of course, another very embolism. This can happen in a moment's notice. It's too fast to get kind of have the doctor help you. And I think that's why the whole system is set up that you have somebody just visiting with you to help you in case it goes south.
I understand you would have the same challenge with a stroke victim or a heart attack victim who doesn't think they're that sick and they don't want to go to the hospital.
Exactly.
And so, again, I'm not sure where we fit into that. I understand because COVID is so contagious and it doesn't just affect the victim potentially, that we may have to take extra efforts and may take extra steps to prevent or to protect the public at large. So there is a difference between a stroke and a heart attack and say COVID.
And exactly, John. And you have to think of once they have a positive COVID in a household, the whole household needs to follow our instructions because they are apt to get sick as well. So if you don't do that, you're going to go from a family cluster to a, larger cluster, and that could get bad, could get worse and worse and worse. So it's almost like you're dealing with a family and not just one person. It's almost like you're a little bit like you're social worker.
Yes, it could be any number of people who could come in contact with a COVID uh, contagion. What we're having to deal with now is we need to find somebody to fill in as the public health director. We're working on that. Uh, we may have to exercise waivers to do that if we're going to do this in quick order. because finding somebody that meets all the qualifications of a certified public health provider or somebody with a master's in public health, um, it can be challenging, as you understand. The next question is, what do we have to do? Paul had come to us with a list of demands on last week, on Wednesday, I believe it was, and he was supposed to get back to us with a refined list of what he needed to do so public health could function efficiently dealing with this crisis, and an estimate of what type of people we would need to hire if that's what was required, and what kind of compensation we'd have to provide for that. There were several other side issues in there about if they were contractors, do they have to carry their own insurance, things of that nature. We never got the list. He never got back to us. He quit instead. And so we're left a little bit in the blind as the commissioners as to how to go about this. We just can't put out an all call and start hiring people if they're not suited for the job. And so we need advice on that. I don't know if you're prepared or would be prepared to give us that advice, or if you know of somebody that we could speak to.
Um, I just know that he was offering $20 per hour, but I don't think it was the pay. I think it was their liability concerns. Really, I do.
Okay, so that's something that working with the county attorney and human resources and things of that nature, we could probably come up with a resolution for that if that is the barrier. But that wasn't presented to us until the last minute, and then the next day he left before we had a chance to even have a conversation and clearly understand what the needs were. So I'm sorry that this extra burden has been dumped on you at this point because you are our only nurse, right? And I assume you have other duties besides COVID right now. I don't know what those duties are, but I'm sure you have them. One of our frustrations is we've never been able to get a clear picture of exactly what all of the people inside our public health department were tasked to do. What were their duties? It sounded like they were somewhat blended. People kind of worked cross programs and what have you, but we've never gotten a clear indication of how all of that worked. So it's really hard for this board to make any kind of a coherent decision without a clear picture of what has to happen down in the public health department. I'm not asking you to answer that question right now, that concern, but you understand our challenge as we face this and try to do what's right. Right now, today, what do you need?
Well, basically, what I'm thinking is I'm trying to think ahead, and thinking ahead would be the protecting your neighbor phase. And there are 8 metrics that we have to be able to prove we can fill in order to be eligible for protecting your neighbor, meaning if people or more, right? So I would like permission to try to work on the ones that have to do with contact tracing, because we aren't even close to the ability to fulfill these metrics. So that would be, I would need to be able to work with other local public health agencies in the region in order to work on these. I'll just give examples, the statistical part. Statistics will be used to determine if you have too many cases, your positivity rate is too high. All that comes out of the regional local public health emergency operations center. And then we have to work on a surge capacity tracing plan. I know what happens when we got up to 18 cases. I would need, I have 4 people now, I would need 2 more people in order to be able to do those 18 cases in an adequate fashion when we get those surges or an outbreak.
2 more people meaning what? Public health professionals?
Like the nurse, if we could hire a nurse and maybe one more contact tracer.
Are you saying those would be full-time people?
No, I think the contact tracer would be like our current contact tracer. They just work as the work presents itself, contract. They might be working many hours, but it would depend on the surge.
Correct. So to handle the surge, you would need two more people on staff, one of whom's a nurse, the other would be, I assume, a trained contact tracer.
Yes, that's
Okay.
somebody like the person that we have located now. The person's doing a fine job.
And so we have one on staff right now, but to handle the surge, you would need another one.
Yes, and I think unless it really, you know, if it really just went over the top, I think with 5, we could do the surge, but I'm not even close really. We've got, with the 6, I'm not even close really because, the 2 office girls are good, but they are only gonna be able to do the easiest of cases.
Okay.
You can't assign them those difficult people.
Sure.
Like
You said there's 8 items on, 8 protocols or metrics on the safer or protect our neighbor. Are there any others that are urgent that would require us to do something other than what we're doing right now?
We have to keep a good dialogue with the hospital because it also depends on number of hospitalizations, PPE supply at the hospital. That's part of this too. So we have to be sure the hospital is meeting their criteria as well.
Okay.
And testing capacity, that's the hardest of the 8. Testing capacity, if we had a surge, how are we going to get those people tested? We have been able to do it so far, but that's a regional question and that would have to be covered with more than just because the healthcare providers operate in more than one county.
What's the challenge on the testing capacity?
Just after a cluster, you have to get out there and test. So to date, we've been using Valleyway Health Services and they've been doing a spectacular job. But I don't know how long that relationship will work. They have their own, complications going on.
Is testing
Excuse me?
Are the testing supplies a problem?
The way it works is you order the testing supplies, and then they send them to you. But our testing would be most likely for an outbreak situation. Testing by us. Otherwise, people are they're just getting to the convenient care clinic or each hospital and getting the test.
Do we have some tests on hand or an adequate supply?
We have, I don't know the number now because we have been kind of distributing them to the people that needed them, but a testing clinic is a big undertaking. So we've been outsourcing the testing because Ballard has a mobile van. They have the nurses. So far, they've been helping us when we had to do testing in a very short period of time. Because a testing clinic is quite involved. You'd need like 30 people to help you off a testing clinic. So we've been using our partners.
So, well, I don't want to go down this rabbit hole, but at one time, the National Guard was considered as an option to operate testing sites and conduct testing. And the HCC, Healthcare Coalition, was adamant that they did not want the National Guard in. And now I'm hearing that testing capacity is an issue.
Well, the National Guard has been helping with outbreaks primarily. Outbreaks and long-term care facility baseline testing is what I have been told.
So the point on this, the goal here is to make sure that we're offering whatever supports we can and that we're maintaining our relationships and those open lines of communication with the person testing and how to do the testing. So we just need to make sure that we're intentionally continuing those relationships, and that is something that's going to take effort. And is, I think, trying to say for this one is we don't necessarily want to build up our capacity to the point where we can host our own clinic. We just want to make sure that we have the steps in place and the partnerships in place that as soon as we have an increased need, they're aware that we're coming and they're ready for us.
And I can say that they've handled all the outbreak situations that we had in a fantastic fashion. So far so good. And then if people are symptomatic, they're encouraged to go to their local hospital by calling or to the convenient care clinic to get a test. That's how we've been doing familial, COVID testing, people who didn't get it at work or whatever. People who get sick, we're asking them to determine, is it COVID or is it not? And they're just going to convenient care or either hospital to check that out. And that the idea there is, if you find out it's COVID, then you catch it in time before they can expose anybody else.
I appreciate the frustration and the difficulty here, but what I see from a systems analysis perspective, I'm going to cite one example. You said that we have to wait to get numbers and statistics back from regional. Is that correct?
They're doing the mathematical analyses like the positivity, high, medium, and low. Those are software type calculations. And those are the kind of calculations that they're asking for here to determine if we pass and could move on to protect your neighbor.
I guess maybe I'm a little bit dense here, Diane, but it seems to me that it's basic arithmetic. And also it would seem to me that or from what I understand, the testing facility is the one that gets the results back from the lab. Is that correct?
It's entered into a system, and then public health and the testing facility both have access to the positives and negatives.
Who enters it into this? Where does the lab result, where is it sent first?
Into that system, so it can be accessed by people at the same time. So the lab's going to enter the result into this CEDAR system, and then all of the impacted parties, so the place, whoever's referred them for the test, whoever did the test, they're going to be able to go back in and see what the result is.
Okay, so in theory, then our public health department could access that system as quickly as anybody.
Yes.
Okay, so we really don't have to wait for regional then.
We do not have to wait for regional to know, yes, we add another number to the total cases, but the type of math that we get from the system, we don't have the capacity to do here. It's a complicated analysis. We're not prepared for it.
I think the regional epidemiologist is getting help from the Denver CDPHE specialists. That's how they're generating those statistics. They generate a positivity rate of less than 5%, cumulative incidence, number of tests per day, all this sort of thing we'll have to calculate in order to pass, to move to the next level. So it is like a partnership, because the people in our county are using clinics in other counties, etc. We
Okay, it still sounds like a somewhat of an awkward system in terms of dealing with something. Diane, you made the point that we have to act quickly in these cases because of the threat. And yet what I see is a system that creates bottlenecks and makes it hard to make those real-time decisions. It's not necessarily our public health department that's the bottleneck. You're only able to act on the information that you have.
Yeah, so Diane's not gonna act on this analysis, on that complicated analysis that we're talking about. That's not gonna affect whether she contacts an individual or not. That's
Right.
for the larger question for the Board of Health to consider and for the state to consider on whether we're ready to move on to the next phase. For Diane to get into individual information so that she knows or they get a certain amount. We have that anyway. Not limited information.
And even at the health services point of contact, the person tested is told, until we know the result of the test, the universal message that they should not be circulating is there from the day they get the test. It's important that you keep reaffirming to the folks that they need to do this, because what happens is they wane and they get more lax about it as the days go on. So that's why I think the Center for Disease Control thought that the contact tracing is the way we can keep people following their instructions. For the most part of the 45 or more families I have contacted, they have all done exactly what we have required them to do. I can't even think of a family that really didn't cooperate. So it does work. I can tell you that the contact tracing is keeping people from circulating while they're sick.
Thank you.
Okay,
Go ahead, Suzanne.
there was a statement in there that, about regional. We don't have an issue with working with regional, that I think that's a spectacular system. But where we have had issues is whenever all of the communication is with regional and the Board of Health locally doesn't get the information, and all of the decisions are made by regional and with regional without the input of the Board of Health. That's where there's an issue.
Gene, do you have something to say on this?
I think what we need to do is in these meetings we're having, we need to go ahead and put this stuff down and go after it. We need to see if we can find this nurse and this other contact tracer and be prepared with things. Oh, and this thing pops, we're in trouble.
Okay, what we're faced with today as the Board of Health and the Board of County Commissioners is how do we take care of the staffing shortfall and leadership issue within our own public health agency. This is a good segue. Tony, I haven't talked to you, or we haven't talked to you specifically, you Trish, about you taking on a function at the Board of Health, or not at the Board of Health, but the Public Health Office. What exactly do you see that you could do to help?
Jean's turning the camera, but the owl is right in front of me anyway, so I'm gonna move that real quick. I will answer with some of my concerns. Not having an interim public health director right now, I'm afraid of moving forward too quickly and trying to get a permanent director in. I don't know who's going to apply for that job, whether the Board of Health was right or wrong or otherwise. When you Google our county health, you don't really find a place that you're necessarily gonna jump on working. So I'm a bit concerned about that. I'm also concerned for the staff that we do have remaining. I think we've got people who are really overwhelmed. They're really worried. I don't think anybody's necessarily ready to walk out the door, but I think right now what they're feeling is that this is too much. So with those things being said, if you bring in another person, if whichever board you're acting as brings in another person who, for whatever reason, isn't able to stay for long term, it's going to do a whole lot of damage to the staff who we have right now. So I am really excited to get started on the work that we talked about before with grant management and making those positive moves for our county and getting funding and all of that. But I think the thing that I could offer is to take on some of those administrative responsibilities that the interim director position would have for the time being. And I would ask that you guys say something like at least 6 months so that we have time to stabilize the department and I'm saying at least 6 months for a qualified public health director or fully qualified. Most of the qualifications I would technically meet, but I think we need to do a long, really good search for somebody who is public health. that is what they do and what they want to bring here. But right now, that's my concern.
In terms of load shedding on the other public health workers,
Mm-hmm.
if you were to step into the position you're describing, how would that specifically help relieve the load that's on the people we have on staff right now?
I think a lot of people have concerns. Kaylee, Ida, and Diane all have concerns that they're not able to meet the requirements that they have for their day-to-day work right now, and that's just kind of piling on. So I think it's important that we figure out how to get either accomplish that by bringing on new people or spreading out the responsibilities, or how to communicate with the state that we're currently in this situation and we need to focus on COVID first and adjust our requirements for our other programs. We're not going to get far without getting another nurse. That's just true. We cannot put this on Diane. So I think whatever we need to do to get another qualified nurse, we have to do.
Okay, so this kind of answers to two different questions. One is immediate staffing requirements. We need to hire a nurse.
We absolutely need a nurse.
I'm assuming that there are options on hiring nurses besides just going out and advertising for nurses. To my knowledge, nobody's come to us and said that there are places where we can hire temporary employees, specifically nurses, qualified medical people. I assume there's some organization out there that provides those services, perhaps not in the county.
I would assume that there are. One concern is that we're not the only people looking for nurses.
But we haven't even attempted to contact anybody that provides those services at this point.
Not that I'm aware of.
Okay. So if you were to take over an administrative function, I assume part of that would be making sure that the duties are assigned appropriately. You said COVID first, obviously that's a priority, but we also have these other programs that we're responsible for, and somebody needs to make sure that those duties are assigned appropriately and the work is being done to meet the grant requirements.
Well, I would say that we need to assure that it's either being done or that we're communicating and we're not digging ourselves a hole to say that we absolutely cannot do this at this time.
Okay, and is that the role that you would see yourself filling?
For the time being, yes.
Okay, I understand it's temporary, and you're saying 6 months, which probably is a good transition target. Gives us time to do a search for a public health director, but in the meantime, we immediately need to have, from what I'm hearing, is a full-time nurse on staff in addition to Diane at this point.
Yeah, we need at least a full-time nurse. I would not be opposed to looking at 2 nurses, would be at least half-time COVID exclusively. To do that contract tracing, hired on a temporary basis, understanding that they're here as a response to the pandemic, that second position.
Okay.
That frees up
So
a considerable amount of Diane's time, and it also frees up our office manager to do the work that she needs to do. This is overwhelming problem.
So you say that if we were to add these duties to your current duties, that you could accomplish a lot of these short-term goals and objectives.
I can guarantee that I will give it my absolute best. I don't know how easy it's going to be for us to find nurses. That isn't our priority.
Yeah, it's an unknown, but we don't know until we ask the question.
Yeah.
And then along with that, we're going to have some sort of pay recommendation for those positions. If
Yeah.
$20 an hour is not adequate to hire somebody, we need to know that up front so we can uh, deal with that, that we can pay for what we need.
Mhm.
Uh, we're not in a position to make a decision today specifically, but I don't think personally that we have the opportunity or the time or the luxury of dilly-dallying on this or waiting. Um,
But I do believe we have previously made the decision that we need to put out the job opening.
It's actually posted already.
Correct. And so I think we're still in the same, I think on the nurse, we're still in the same position. We've already made that decision. We need to just hire a nurse. On dealing with the public health director, we can wait and visit about that at a regular meeting where we can make a decision.
Okay, I'm going to go back to my question. Have we posted a job opening for the public health director?
No,
Okay, so we published for nurses.
we published for a nurse position, yes.
Okay,
And there is an hourly rate on that, so if you all decide Wednesday that we're going to be more flexible on that rate, we would have to just adjust that.
okay.
It can also be posted without a rate.
It can be. I think having had it already out there with the rate, we may want to consider updating it, but that.
Well, that doesn't require a decision on our part specifically, other than if common sense dictates that we change our posting to give us the flexibility to pay whatever the competitive rate is to attract qualified personnel. The board doesn't have to micromanage that effort. And we said early on when we were talking both to Emily when she was public health director, and we made it abundantly clear to Paul Wirtz when he took over, we will do whatever it takes. You just tell us what you need. Unfortunately, we weren't provided with that information. And so we're behind the power curve on this. Not because we weren't trying, but simply because we weren't getting the information we needed. And we're not aware of the challenges they were facing. And I won't go into the details here, but that was part of our discussion the other day with Paul Wirtz. We were somewhat distressed that we didn't know this problem existed. We didn't know that we had not retained the nurses that we were told were available. We didn't have numbers.
Mhm.
And then it developed into a crisis, got ahead of everybody, and now we're having to deal with it. And we could have been ahead of this 2 or 3 weeks ago easily, but we were not. And so we're trying to figure out how to basically repair the damage going forward. And also part of that conversation with Paul Wirtz is he at that time made us aware for the first time that there might be other COVID monies available through the public health system to help fill these short-term requirements. Again, we didn't have that information. Tony, I'm assuming that you're fully capable of getting us all of that information.
We'll have to dig through the information. I know that I saw the $300,000 grant, and I believe it's going to be over 3 years. So that's it. So
I also see that regional is trying to tap into what appears to be that same pot of money.
So if we do want to move to the protect your neighbor status, we're going to need that high level of skill that we don't have here. So we're going to need to either work with the regional to get that, or we're gonna have to commit a whole lot more of our budget to get that.
Well, right now, the concern doesn't seem to be so much moving on to protect our neighbor to actually functioning well and taking care of this contact tracing and what have you. I see two components here. One is actually taking care of the public health.
Right.
And two, doing it in a manner that we can get approval to move into more relaxed standards if and when it's appropriate. But right now, we can't do any of that until we take care of the immediate problem, which is a staffing issue. And quite frankly, I think an organizational issue, not just in our department, but our relationship with regional.
Mhm.
So
We can definitely improve communication. We can work on that as a priority. Understanding that we're so many months in, and everyone is pretty overwhelmed at this point, and you're right, we're gonna have to repair a bit before we can really, in a healthy way, consider moving forward.
thank you. Other commissioners?
No, I think we're good. I think we just need to go ahead and keep working on this and go forward as quickly as we can in a safe and timely manner for ourselves. We need to today for the county, and I think by putting it out there, we can go ahead and get those people. The biggest word I heard again today, as in the last 2 or 3 we've had over items, is communication. There hasn't been a whole lot of, there's been a lot of talk, not a lot of communicating. So I think we need to get that.
That's an important distinction, Gene. Suzanne?
I've kind of asked my questions as we went along.
Okay, thank you. Then procedurally, I don't know, so I'm going to make a guess here, that we don't have to take formal board action in this instance where we have declared a county disaster or emergency, I don't remember the exact terms, that Trish, who is Tony's supervisor right now, with with Tony handling the grant management side of things, that you would be authorized to release Tony for a portion of her time to deal with the public health, acting as, I'm going to call it, for lack of a better term, administrator, while we embark on a search for more nurses. Tony will help in that because she has access to numbers and what have you. And we will also then publish an advertisement for a public health director. That conversation is going to be more involved than we're going to get into today. Does that say it, Tony? Do you and
I would
Trish?
ask that you don't publish the request for a public health director at this time. If we leave an ad-in for 6 months, it's definitely not going to have the kind of impact I think we would want to have once we.
I missed that. Say it again.
I would ask that we don't publish an ad for the public health director at this time. I think if we leave that on for 6 months, we're going to.
What I heard was don't publish right now.
Yes.
Okay. I guess that's the operative part of your comments. The rest of them were garbled. Not your fault. It's just the system that's giving us trouble. Trish,
Yeah.
how are you with this, and how do you see it working with Tony operating, both taking care of the general grant management for the county and also handling the admin function and organizational function over in the public health department?
I think it would work very well. I don't think there'll be any issue with organization, and Tony knows she can always reach out for help to me as well.
Yes.
Do the other commissioners have a problem with authorizing this right now? If we need to even authorize it, other than just say yes, and then if we find out that we have to take formal board action and a formal vote, that we can do that and ratify what happened today?
I think that's fine. It gets us going and say we're not dragging our feet for another 2 or 3 days waiting to have another meeting. I think that's good to go that way, John.
Thank you, Gene. Suzanne?
my thought is it's not, we're not hiring somebody, we're just shifting duties, which is no different than any of the other stuff that we've done with COVID. And so I don't, in my mind, it doesn't require official board action. I think if we feel like it needs a vote, we can certainly vote on it on Wednesday or have that discussion in an open meeting. But I think absolutely that Tony is very well qualified, and she has working knowledge of public health, which I think is much better than anybody else that we could put in that spot.
Thank you. My concern is this, that we have a clear understanding of what our expectations are on everybody's side. That Tony understands clearly what we expect, and our expectation, quite frankly, Tony, are going to be driven by you. You have a view of how this can function. We also want input either through you or directly from, let's say, Diane, how this works for her and what she sees happening. And I don't want to get into this confusion and the muddle that we seem to keep drifting into. Whenever we assign duties, we assume that certain things are going to happen, and then we don't find out they're not happening until it creates a problem. We are, as a Board of Health and Board of Commissioners, totally dependent upon our staff and the people they work with, including regional and other organizations, to keep us fully informed so we can make that we are aware of problems before they become major trouble, and that we can make the adjustments required. So we would ask certainly that you over communicate if necessary with this board as we go forward. I suspect that when you get in doing this, you're going to find things that we need to address that we're unaware of right now, and that you would communicate that to us immediately, real time, so we could respond to it and do our job.
I would ask that we would need, I would like to schedule a Board of Health, a longer Board of Health meeting, because what I've heard over and over and over again is what we're supposed to be doing with our time and what the staff is doing. And I would just really like to put that away as quickly as possible. So as much information as you need, as much paperwork as I can bring, it would bring me some peace to be able to put that aside so we can focus on our urgent needs. So if you'll schedule
the time. I think that's a very important thing. Practical matter, when can we schedule that meeting? And Tony, how long would it take you to have your information prepared for us?
I would be fine with next week, which I was planning on taking off, but I'll talk to Trish about this later. So if you guys wanted to think Monday, Wednesday, whatever really works for you, we're gonna need, I think 3 hours will be fairly low, but it will give us a place where then you can come back with questions for the next round.
Okay, so you would like to block out 3 hours in a meeting for us to discuss these items, is that correct?
As terrible as a 3-hour meeting sounds, I wish.
We gotta do what we gotta do, right?
Yep.
Okay, Trish, can you set that schedule up?
I can. I would recommend the 22nd. It's a special meeting. This upcoming Wednesday meeting is already pretty full.
Well, she said she's gonna need a little time anyhow.
Does that work for you, Tony?
That does. That'll be fine.
Okay, so it's set for the 22nd. In the meantime, Tony is going to assume additional duties. She will still be working for or under the county administrator. She will not be working under public health. We'll figure out how we account for time and money. And I'm assuming, Tony, you can come to us with a recommendation on that also.
Yes.
Okay. Are we all good with that? Is there any objection?
Yes. Good.
Okay, Tony, before we go on this, I have a specific question. We were advised that there may have been a mess up in one of the CTC grant line items, and that we may have overspent in that line item.
Yeah.
Okay, can you tell us about that?
So our CTC grant had $5,000 total for stipends to partner agencies.
This is another stipends issue?
This is a stipends issue.
Okay,
In this case, Nancy has done a great job in outlining responsibilities for partners. So we at least have that. What happened with the line item is that generally in a grant year, you guys know now, you can move the 25% within 20% without seeking any Remember, in this case, there were 4 entities listed in the line, 2 nonprofits and 2, I believe it was the 2 schools, and the total for that line was 5,000. So what the program manager saw come through was that we had one entity that used up the whole 5,000. Now, from my understanding, what happened is that the council decided because we were going to have excess in our budget from not traveling and they were going to put into stipends to help support partner agencies. Unfortunately, we didn't seek approval before doing it. So that was kicked back to us. They'd like some justification. So now working with Nancy and Trish has been what we're doing is we're putting together the request and we're begging that they will let us retrospectively go in and approve this change. Our partner agencies have already been paid, checks are cashed. So hopefully CTC will take sympathy and they will allow us to postpone. If they don't, they will allow the original request. My best guess is they would allow the original request only, and we would be left with those additional funds that we come out of our general account or our backup.
so worst case is we might have to reimburse a portion of that CTC grant if we don't get approval or retroactive reassigning these funds.
It wouldn't quite look like that because they won't put the invoice through until we have a number on there that they're going to approve. So we wouldn't have to repay anything. We would just need to move the funds here on our end, on our accounting. We'd have to say we didn't take that amount from CTC, we took that amount from our general.
So the county, regardless of who we write the check to,
Right.
it would come out of county general in the worst case, but you're working diligently to see if we can get some relief on that?
Yeah, it would come from our public health account. It wouldn't come from the county general account.
But
That's why I needed was to clarify that, not general fund, but the public health department of public health fund.
But the portion that, we can't take that out of another grant, public health grant. So, right?
So we would take it out of our public health reserve.
Okay, but that public health reserve is basically funded by county general when we allocate a certain portion to that department. I believe it's around 90,000 a year.
I can't tell you that. I know that's a lot of that indirect fund that's been building up. It's anything, so these foundational grants, if we have administrative, a lot of the stuff that I've been talking about that we're kind of holding back on spending administrative funds has been going into the reserve instead of going into what we could be spending to make sure we have capacity for things like this. Okay, nobody would have had capacity for COVID, but we would have had a little bit more capacity if we could spend those funds instead of constantly putting them into the reserves. It's good to have a reserve, but ours we can spend, we ought to be spending in an intentional way rather than reserving how we do. But
So when we have our 3-hour meeting, we can dig into that a little more and you can explain it to us, right?
Happy to.
Okay. Is there any more on this subject now?
No,
Okay. Gene?
No, I'm good.
Trish? Nothing? Anything from Tony and Diane?
I'm okay. Diane's shaking her head.
Shaking her head or nodding her head?
She's shaking. She's saying no.
Yeah, okay, she has nothing else. Okay, and that takes us to number 2, the public health director job description. Based on Tony's recommendation, are we willing to set that aside for today while we take a harder look at that job description and how we're going to go about posting for that position?
Yes.
Okay, good. If you guys want to get back to your work, because I know you're overwhelmed, you're welcome to go back to whatever cubbyhole you set in for the day.
Okay,
Thank you for joining.
thank you. Thanks very much.
Thank you.
And if it's okay with everybody, I think I would like to take a short break.
How long a break would you like, Suzanne? I don't care. I just need to know if I have time to make coffee or not. Huh?
3.5 minutes.
That's not enough time for me. Is anybody, can we make it 5?
That would be
5
fine.
minutes is good.
Okay. We'll convene here in 5. Gene, how's it going today?
Good so far. Hey, I just walked by and Randy said just for me to holler at him when we were ready, for me to come in when we were ready.
Okay, so he is in today. Good enough.
He's at his desk. I checked on earlier, so
Okay. Does he look like he's in pain?
he is. He said that he's just medicating himself enough to get by until he get that MRI done. They haven't scheduled it yet, so.
Okay. Well, we lost our reporter, but we gained Phil Paccioni, I see on here. So we can continue with the budget preparation policy discussion. And Trish, you sent us, I know we've had copies of that, and you sent us another version. I'm looking here so I can pull it up. I had other items up on my computer. When did you send the latest?
On Friday. It was sent at 3:49 p.m., labeled work session, agenda, and documents.
I've got it. Okay, thank you. Are we all ready to, let's see, we're waiting for Gene to come back.
Sorry, John, I had a call.
No, that's fine. You gotta do what we gotta do. Okay, Trish, without going through the whole document, you highlighted and had some areas of concern. Do you want to kind of go through those? Or does anybody else have comments having read this?
I think pretty much all my questions were on the areas of concern that Trish had already highlighted. And I think a lot of it is just, we need to make small decisions within here.
Okay, Trish, the first one I see on here is section 5.2, but there may be one earlier than that. Do you have something prior to that?
So on section 2.7.4 would be the first one, and that is just emphasizing that the policy states the Monte Vista Journal and explains that that has been selected as the official newspaper. It would be my preference to remove the Monte Vista Journal and just reference the county designated newspaper in case at any time we might change papers. We don't have to remember to go back to individual policies and delete and change that sentence.
And I think that is very much appropriate, and I think that it's also referenced at maybe one or two other places in the document. And so I think it would be appropriate.
Okay, and I don't think we have to vote on any of this right now. It's a matter of making the changes we agree with, and if we have to have a vote, we can do that when we see the final document.
It would be, vote to change the, to approve the policy as adjusted once we're finished.
So is there any reason not to come up with a generic reference to the newspaper of record?
No.
And I believe that there's probably an official term for when we designate the official newspaper.
I think it may be called the official newspaper of record.
Okay. Let's make sure that language is consistent then. Any more on this one? If not, what's the next one, Trish?
The next one would be 5.2. This policy references policies for budget revision and development. That currently does not exist. I do think a large portion of the issues with this particular policy is when it was created, it was a copy and paste from a different county, and a few things were overlooked in removing that currently we don't have, or policy procedures we don't currently follow.
Do you have suggested language for that? Have you found another policy of some other county or CTSI or CCI, anybody?
I think that most of this policy is good. I think if we can just go through and take out the things that don't apply to us, which should have been done before, but it apparently never was. And so if we can just remove that, if it doesn't apply to what we're doing, just remove it and move on.
Trish, are you suggesting that it's not required? Section 5.
That is what I'm suggesting, to completely remove that section.
What is our policy for revision and development?
We have our entire budget procedure, which this, and overall with this document too, which we can discuss in detail within this conversation, it really needs to be completely separate. You know, there's financial plus procedures all in one document. It works. My opinion is it should be separated into two different procedural plus financial policies.
So we would have a budget policy, a budget development policy, and then we would have a separate financial policy
It
document.
would be a budget procedure.
A budget procedure and a what?
And a financial policy.
Okay. All right.
And are those what you're referring to? Are those currently contained within this one? And
Correct.
so we want to separate it out?
Correct. That would be my recommendation.
Okay. And so I'm assuming that whenever we get to that part, that you'll say this part needs to go into this other policy?
Correct. Yeah.
Okay.
Up to this page so far, it's primarily been budget procedures.
Okay.
The next, I mean, if you agree with
Well, okay, so
striking that out,
say we remove that with the understanding that we're going to come up with two policies.
correct.
Okay.
The next one would be 5.3.3. The BOCC sets its budget priorities so that the county administrator and or designee may oversee the creation of the recommended budget. So my comment is decision is before the recommended budget. Does the BOCC want to commit to that? So going by last year, this was something that, well, wasn't exactly decided on or discussed till much after. The recommended budget was already presented to you. And there's another similar, this would include, which I'll just kind of jump because this would also include the wage increase or lack thereof and insurance decisions.
And this one is talking about community needs, which is basically the San Luis Valley Commissioner list, I believe.
No,
Is
so
that
if you remember last year, when mainly in the budget message, it discusses the goals. So that's what it's really referring to, is the goals for the community.
Okay. And that's kind of the last thing we do, isn't it?
It should be before. So, you know, if you discuss what it is you want to accomplish in the upcoming year. In order to do that, you would need to, if it has financial plans, if you decide that it's your goal to create something out in fairground in Del Norte, obviously you would have to budget for that. And the monies would have to be appropriated to whichever fund that would be. So it would need to be before.
To address Suzanne's comment about the San Luis Valley BOCC, yes, they do address some community needs, but we also do our own, such as the museums, HVCC, and others that we support. So there's kind of two chunks of community needs, or two areas where we address those. But in my estimation, the first thing you do is figure out how much money we think we're going to have. What's our income going to be, our available resources, before we do anything. And then within that, we have certain mandated things we have to cover. Jail, sheriff, public health, weed, what have you. And that we would go through that. And then while we have a wish list of community needs that we would like to support, we could then prioritize that. And that's a broader conversation with different entities in the community.
But I think what we're looking at here is at which point of budget preparation should we be talking about that, correct? Trish, is that asking? Okay.
Correct.
Do we want to have that conversation before the budget or after the budget? I think before.
I think, again, using the term systems analysis, we're talking about, if you will, a flow chart of how this budget process works. And obviously the first thing is we have to figure out income before we can decide anything. That potentially could be a real issue for us in the coming year. Even if we get our tax revenues as anticipated, there are the area where we get state funded or state monies to fund certain county programs. We've already been alerted that some of those programs are going to be eliminated or reduced. And I would suggest that you do the have-tos first and then deal with the community priorities, whatever they look like. And that could be anything from what we use CTF funds for to whatever. But we can't, if we start at that end of the rope, we're going to spend an awful lot of time speculating on how much money we should spend or support or use to support these needs, and we don't even know if the money's available. Our hard part in the budget is going to be figuring out how to fund the mandated, and in some cases now, the unfunded mandates, specifically the Law Enforcement Integrity Act, which is probably going to have to come either strictly from County General, or hopefully we can find some grant sources to help pay for those additional expenses in the Sheriff's Department. But he's already alerted us that could amount to several thousand a year.
Well, in every year we have unfunded mandates, and a lot of years we have DSS that has, we believe this is the way it's going to be, and then you get a little ways in and find out that that's not the way it's going to be, that you have the unfunded mandates every time. But I think your highest priority is figure out your statutory requirements, your revenue, you're right, and then your statutory requirements that you have to do, and then you hope you don't have too many unfunded mandates. And some of them turn up in the middle of the year.
They do, and we have to adjust as we get to that point. But we can anticipate, for instance, the Law Enforcement Integrity Act cost, and then we have to figure out how we're going to pay for it. Worst case is we have to pay for it out of county general revenues. Social services, there are times where we are at risk of having to pay for programs out of county general revenues. And we need to know what those risks are, and we can assign probabilities to those risks and say, probably not going to happen, or definitely going to happen, or somewhere in between. And that helps us get a better picture of how much money we actually are going to have for other programs. And we can say, 10% probability that TANF is going to have to be replenished through our funds or whatever. And I'm just making stuff up here. And so are we willing to take that risk, and we're going to go ahead and commit to community efforts? And what community efforts, and how are we going to pay for it?
But right now, I think what we need to do is get a policy that works and get the wording within the policy where it works and where the timelines, because I think on a lot of this, the timelines is maybe the issue, is it puts some of these processes in the wrong order.
Jane?
Yeah, I think looking at this thing, I've read through this a couple of different times. I think in looking at it, I think a lot of the stuff here is we need to go ahead and make the adjustments. And whether we're going to get in the weeds as far as whether it should be before or after, I'm not real sure. I think there's an argument for both ways, but we need not to dwell on that so much we forget the point of whatever it was Trish was after in the first place. So we gotta just take a look through here. Maybe we just need to go back after we get through this and look at it one more time on our own, and then have Trish make the recommendations about that.
Okay.
Does that make sense? I'm sorry I rambled on that, but I was trying to figure out a way to put that, because it looks like we're going to spend as much time on trying to figure out whether it should come before or after, and I'm not really sure either case is really necessarily wrong or right. I think there's an argument both ways on that. So,
Well, I think that what she has done is made the recommendations for the changes in this document. Is what you're asking for her to do is revise the entire document and then say, this is what I've changed? What is it you're asking for?
Well, what I'm asking for is that we consider this, and we got hung up on this. I didn't get hung up on it. The program and community needs. The operative word down here, or operative phrase, is the BOCC set its budget priorities so the county administrator and or designee, and that's repeated in there, so we can delete that, may oversee the creation of the recommended budget. We don't even have to talk about community needs or anything else. All we need is that phrase.
Okay?
And this comes in, as she says in the red there, decision is made before recommended budget. And I'm not sure what she means. Does the BOCC want to commit to that? Is the question, does the BOCC want to commit to giving the administrator a list of priorities? Or rank ordered priorities, I assume.
Correct. So, going by last year, this was something that quite frankly and honestly was approved last week on a lot of it, which would be 6 months after the budget was approved. So are you wanting to, and I am going to again include the very next one because it's exact same conversation. This policy that is already approved states that you're going to commit to that before the recommended budget is submitted. So either the BOCC would like to commit to coming up with those goals and budget priorities before the recommended budget or after. And then that would also include the merits, cost of living, what we're doing with the insurance to happen before the recommended budget is presented or after, like last year.
I think part of it is that the administrator's function to come forward with a proposal. In the past, I understand the administrator was the one that developed a proposed budget with little input from the commissioners until it was presented. At which point, the commissioners were presented with a lengthy document without clear explanations of the relevant points. Some things kind of go without a lot of thought. But other things, and we came up with, say, insurance, pay, step increases, whatever it is we do. Uh, but the administrator is kind of the collection point on all of this. The administrator should be the one that is aware of what the sheriff's department's needs are going to be and the impact of an unfunded mandate in the sheriff's department. The individual commissioners should not have to go out and dig that information out themselves.
And last year, since Trish was very new, we did not give her that authority. Are we prepared to give her the authority to basically prepare the budget? And then the commissioners see the budget after her preparation?
I'm not sure it's a binary question. I think there's a process question here. And so neither one of those may be the answer we're seeking. Maybe it is. But right now, it is the administrator's responsibility to gather all the data from the various departments, whether it's a budget proposal or whatever. And then it's the administrator's responsibility to deal with, I'm going to use a specific example, but I don't want to get hung up on it. I've been told repeatedly by Trish and others, Ronnie, that each department tends to pad their budget, and so it distorts the actual numbers, and the commissioners are left to guess. And what it does do is it lets the departments over budget and then come in under budget and make themselves look good. But you cannot manage using that technique. You simply cannot. No business could survive doing that. And so I would say that the administrator needs to go through and kind of truth these numbers as they come in and make sure that there's not excessive padding going on. Everybody wants to pad a little bit. They need to because they don't know if the price of postage is going to go up or whatever that they have to budget for. But some of that stuff, the obvious padding needs to be identified. And the administrator needs to make recommendations to the board about those items. When we get into pay, that whole compensation thing is a goat rope, as we well know. I was personally very uncomfortable last year when we did the insurance versus pay raises. Clearly that became an issue this year in a couple of instances, and we were having to defend a decision, and I don't even know if we resolved any of that. But a lot of that stuff should be cleared up before we ever have to start making hard decisions. The administrator can give us a heads up as we go through the process before she has to present us with numbers and say, I'm running into this problem or this concern, and seek our input on that. But it's not a point-by-point briefing. It could be general areas, and the administrator has to be cognizant of exactly what needs to be done. I think one area that got really fuzzy was the airport this last year, where we had a reserve account sitting there for a specific purpose, and the decision was made to tap into those funds to make improvements at the airport. And there was confusion on those numbers from that day until today on what was really intended and where the money was actually spent. Those types of things, the board should be made after the administrator does the research on it. They should come, tell us what the issues are, and give us their recommendation or concerns. And that's the process we should be going through. We shouldn't be getting 3 versions or 2 versions or whatever of the budget and then having to go through ourselves and line by line compare them. And that's one of the frustrations I had last year.
So that is exactly why this needs to be discussed and decided right now, because you received 3 versions, because the decision of how much of a merit increase changed 3 times. So therefore we had to plug in those salary numbers. So if you do want to keep this policy that states that you are going to give the merit and cost of living before the recommended, then you would be avoiding that. But you also would need to make that decision and not change it 3 times.
Well, we would need to get the numbers in a concise and succinct fashion So if that was the major issue and was going to have a serious impact on the budget, we would need to see those options in a clear format and a bottom line impact, not just on how much our salaries are going to increase or decrease. What does it do to our overall budget? That's just basically now basic analysis. And then those numbers could come before the board and we could make a better decision without having to have unnecessary discussion on it because the numbers would be right there in front of us. But they have to be presented in a way that they're relevant to the overall budget as well as being relevant to the specific issue.
But I
And then
think-
it almost have to be on a department by department basis because we know that the departments don't follow a consistent pay plan. And so we can have unanticipated increases simply because somebody changes the duties of one of their employees. And
But I
that
think
would,
the question we're
that's
looking
part
at
of what they
here,
have to tell us. What's that?
I think the question we're looking at here is when does that fall into the timeline? Do we want to make that decision before the recommended budget? I think that's appropriate. Because that's part of the budget, and I don't think you can have a truly recommended budget if you don't have that decision made.
Exactly.
Or in the process, is I think in the process of, because the recommended budget is one that is the point where the administrator presents the budget to the commissioners and says, this is what I recommend. However, I think we have to have some input into that and know some numbers before that budget comes out.
And
Because-
that's on page 10, when you have a chance to review. I do think that timeline needs to shift a little bit mildly to about 2 months later than what it currently shows, but that's already presented on page 10. Which
So as
also
far-
includes the review of the revenues.
As far as the statement in here, the 5.5.3 that we were looking at, what you think is that the raises in insurance should be determined before October 15th. I do know, and I don't remember what the date is, but there was a specific date that Jody had to have that information. Jean?
Part of the problem with doing the insurance and trying to do those raises early is that Trish and I was at that meeting last year at CAP, and it was later in the year than what we really, we would have had to been backtracking one way or the other last year because CHP doesn't always make the final determination with its board and its representatives a little bit later in the fall. So
Do you remember when that was?
I'm looking it up right now.
Yeah, I was thinking it was sometime in October, but I'm not positive, so.
I was kind of thinking it was like the end of September.
Whatever it was, we can find out. But Gene, what agency did you say was late getting us numbers?
Well, it wasn't late. It's just the way it works out as far as their calendar schedule. It's a Colorado Health Pool where we.
Okay, so that's the workman's comp and
right,
whatever health insurance.
yeah. And
That was in August, and it looks like our own decision is due to them on Friday the 6th. September 6th.
Okay, but it happened late in the game. And it's really simple. If we get away from being married to that document that we get with all the line items by department, and I complain that we don't see revenue and expenses by department on one page or one section. It's scattered. You have to look at the revenue part, and then you have to look down here. And from a management perspective, that doesn't work. For a reporting perspective and the fund accounting, maybe we have to use something like that. We don't have to use it to make decisions. And we ought to be able to look at a single document, go in and change one number. CHP gets us the numbers on our insurance cost. You plug that number in and it changes your bottom line. And we can immediately see what that net effect is going to be. and then we can make a decision. But we have to go down and go through and do the arithmetic every single time. That's what happened, because I didn't see anything. And as a professional, as a businessman, somebody who's done this stuff before, and somebody who's done funded budgets for counties and cities, I'm very frustrated with this process. And it's not because it's a state process, it's an internal process. And before, the commissioners were able to duck the bullet because they had the administrator do everything and they just rubber stamped it. Okay, we're not in a position to do that anymore. And so we have to get information that we can make timely decisions on and not spend nights at home trying to pick through the budget and see where the differences are. And then have an argument about line items. Did the sheriff's department use the right line item to buy a new vehicle? It should be very clear to us what's going on. And I haven't had that feeling through any of these processes. And this includes when I was watching, before I took office in 2018, I watched the process and couldn't believe what I was seeing. It didn't make sense. And then we end up tripping over ourselves all the way through. So if we're talking about process and not specifics right now, and back to 5.3.3, I'm still like to hear Trish tell us exactly what she would recommend that she get from the board.
I think that this is a decision, and just from the conversation, it sounds like that you guys would want me to delete 5.3.3 and 5.5.3 and decide that after the October 15th recommended budget deadline. So I'm just looking for an answer. Honestly, that's up to the three of you of how you would do it. Our current policy does state that it's due before the recommended budget. So we either need to remove entirety and not discuss it, or move it to be discussed in this budget procedure after the recommended budget.
Those are our two choices.
3, remove completely, keep it before the October 15th deadline for the recommended budget, or move it to after.
Okay, so we have three choices. Do any one of the three facilitate the process? Do they accomplish our goal? What's our goal?
You may not have a goal in that year, so the 5.3.3 wouldn't even come into consideration. However, the raises in insurance always do. So, our deadline to CHP, at least last year, was September 6th. That gives us all the way to October 15th if you choose to leave it before the recommended budget.
Who set the September date?
October 15th is by statute.
Who set the September date?
That's last year when our choice was due to CHP. That was CTSI's date.
My question again is, who set the September date?
It would be the CTSI. That was their due date that we had to.
CHP set that date.
Correct.
But CHP is managed by CTSI, is that correct?
That is correct.
I understand that, but we're using two different terms for the same entity. So I'm just trying to get consistency here. CHP said we had to do something by September 6th.
We had to turn in, that was their deadline.
We had to turn
But that was our determination of which insurance program we were gonna take?
Correct.
But how much of that we covered versus how much the employee covered, that they don't care, right?
Correct.
Okay.
So that, and we're getting into the weeds on this because we could have a dozen examples like this going forward. We don't know. But the process needs to be consistent so it can accommodate any one of these issues as they come up. So September 6th last year was a deadline to select the program that the county was willing to pay for, the benefits program for its employees.
Correct.
We made a decision on that. Then we really didn't know what it was going to cost us until we decided the split between employees and county.
That would be the 5.5.3 decision, correct.
Okay, so I think we're using this as an example Is that correct, Trish? The CHP thing was an example of the challenges we face in the budget process?
So the CHP is one of the two of 5.5.3. The other would be the raises or merit, and basically it comes down to this, John. Either you want to have your recommended budget nearly completed, where those decisions you have already discussed and decided on, or you want your recommended budget to be a open document that's expected to be fully changed after.
Well, you can decide those things you can decide. Some of the things where we don't have enough information to make a decision, for instance, as an example, the CHP, we can make that decision when we get that information, and we can incorporate it into the process and make adjustments as required to other items in the budget. I think this goes back to priorities, and I'm not talking priorities for community programs. I'm talking about priorities in the budget. So let's take, for instance, the airport. Let's just use that as an example. Now, we dedicate a certain amount of general fund revenues to the airport for proposed purposes. But we get the CHP chart, and now we're having to deal with that, and we have to figure out how much of that is the county going to absorb out of their general fund revenues. If we have to, we might go to the airport at that point and say we're going to reduce our commitment to the airport in order to cover this. But while you do deal with them in a modular fashion, each one of these, they do intersect whenever it comes to how we allocate PIL, general fund revenues, tax revenues, and all of that. And so we have to have enough flexibility, but we can't look at the whole budget every time and start going through and making these changes. We need to understand what our options are in a concise fashion. That goes to the administrator to make recommendations. Guys, we've got to do this. Guys, CHP's charging us this. These are your choices. You can take money out of other programs, or you can make an adjustment to the compensation package for the employees. We need those recommendations, and this is what the effect is going to be on the budget. We can't just say we're only going to look at this. In this policy, we're only going to look at one item at this point and another item at another point. We have to look at it holistically, and we also have to look at it with a microscope. So there's a macro event here. But what we need going out the gate is some numbers to operate off of. Numbers would be last year's actuals or this year's actuals to date. How are we doing on the budget? Have we gone way over on something, or we're going to have to do a supplemental, which could affect all sorts of things. It could affect our beginning balances for sure, right? If we had to dip into reserves or do something else, or if we didn't buy something that we needed to buy, and we have to factor that into the budget. I mean, there's a dozen things out there, but for the commissioners to make coherent decisions, we don't want to have to sit there and look at it with a magnifying glass. We need to get a good summary of the pertinent, relevant issues. And that's a frustration.
That budget update is given in a 5-year span for every single one that you gave, not just last year, but a 5-year trend. And you are given that financial report every single month that does show where they are, where the expenditures, revenues, and how much they're pulling out of reserves, if any, on a monthly basis.
But it's not our job to sit there and go month by month and do our own individual financial analysis.
That's what that summary for every month is for, the financial report that you're given every month.
Well, we may need to look at that again. Did we receive one for last month?
You received one last month, and it's on the agenda for Wednesday.
So I have a copy of that somewhere in an email.
Yeah, part of your meeting documents every month.
It's designated as what? So if I go back and look at my Google Drive at the documents, I'm going to find that in every month, right?
Correct. It's
And if
blue
I
and
don't-
white. I'm sure you've seen it multiple times. It's usually labeled the month, year 2020 financial report.
Okay. And I know that when I look at that, when I have looked at that document, when I see it, I am somewhat unclear as to what exactly it's telling me.
So that is the summarized version that you requested, I want to say in the beginning of last year.
You
Or
do
this
have a
year.
summary, but it need, and I'm not going to criticize it. I have to go back and look at it and see what my issues are with it because I don't recall right now. But I do know,
Actually.
looking at it from a financial professional standpoint, sometimes I have not been able to discern from that exactly what we're facing. And part of the reasons I've heard for that was there's a lag time in reporting, say, on revenue, sales tax revenue, right?
For that report is our actual revenue and expenditure. So due to the treasurer having a bit different system is why there's a lag. So for instance, this upcoming one here in July is actually for May. So we're looking at 1.5 to 2 month delay.
Okay, and we can talk about that at another time about how fast the state gets the sales tax reports back to us, how it's broken down, because there is quite a lag on that.
That's an entirely different report that I've been doing for you just for COVID, would be the sales, the highway users, and the lodging.
Back to my point, on the report that we get, the summary should have revenue, actual versus projected, okay?
Yep, it shows
Even
year to
if there's
date,
a lag.
2020 budget, variance, and the percent.
Even if there's a lag, because of sales tax reporting and things of that nature, we should be able to tell how we're doing this year versus last year and how we're doing this year versus our projection for this year.
Mhm.
Okay, and that should be very clear. I shouldn't have to do a lot of interpretation to get those.
This is very summarized, this report that you're given every month.
I'll go back and look at it, but I know that I've been looking at it and a little bit concerned about how that process or how that information is portrayed. I'll have to look at it, Trish. I can't tell you right now. Okay, but I am concerned that I'll bet you right now, not one of the commissioners could tell me how we're doing financially, just off the top of their head. I sure couldn't.
It's too bad Lindsay left because every single time I give that report in the meeting, she puts it in the paper. Front page of the Del Norte Prospector.
Okay,
That doesn't address my concern.
okay. Back to the budget policy. We have some specific timelines, some specific statements within this policy? That's what we need to determine. Because the budget policy should be in line and prepared before we start on the budget. And we're going to start on the budget in the next couple weeks. So can we?
Back to 5.3.3, and I'm having to jump up and down between 5.3.3 and 5.5.3 because you're referencing both in this conversation, and I can't see them both on the same screen. I have to scroll up and down. But it seems to me like that paragraph 5.3.3, we don't have to talk about community priorities right now at this point in the budget. It's the initial point. We don't have to determine that.
So you're looking for, so the answer to my question in red would be no, and to remove that section.
No, it's not that it would be no. I'm not sure that that's what we're trying to say in that section. You're asking for the commissioners to prioritize something. Is it narrowly construed that it is community projects only?
It says community needs an examination of program and community needs and the BOCC goals for the upcoming year.
Okay, but if you look at we're on the 5.3, that statement at the beginning is prior to the creation of the revised current budget and the ensuing year recommended budget, the county administrator and/or designee will oversee the following activities.
What
Then-
is that 5.3.3, Suzanne?
No, that's 5.3, that's the beginning paragraph at the top of 5.3, before
Okay.
you get to the sub-items. Okay, and then under that, one of the sub-items is 5.3.3 that says, in light of the resources that may be available, the examination of program and community needs and any BOCC goals, the county administrator and/or designee shall request that the BOCC set its budget priorities so that the county administrator and/or designee may oversee the creation of the recommended budget. Okay, is that what we want to do? That be prior to the creation of the revised current budget and the ensuing year recommended budget, is that something we want to have done?
Okay, I'm gonna go back up to that 5.3.3. Prior to the creation of the revised current budget, what is that?
So that, are you asking me? That would be
Yeah,
the
I'll ask.
supplemental budget and any discussions for the supplemental budget.
Then shouldn't it just say that, supplemental budget?
Probably.
Okay, take some of the ambiguity out of it. Okay. The supplemental budget and the ensuing year recommended budget or proposed budget, whatever's, you'll look for these following items. So the presumption is the supplemental budget basically corrects anything that we did that was not projected in the original budget. Is that correct?
The supplemental would be any extra revenue that we received and any purchases within that revenue that were made that were not received before, in that prior year when creating the budget.
So
Or
how
any downfalls. of any funds.
5.3.3 affect the supplemental budget?
It wouldn't, but the concern is for the recommended budget.
Okay, but it says right there, prior to the creation of the supplemental budget, we have to come in with this stuff?
And the recommended budget is the next portion.
I understand, but do we need to do 5.3.3 for the supplemental budget?
That is the ultimate question, that for both that and the wages, is that something that the commissioners want before the recommended?
For the supplemental budget, that's basically creating a budget that reflects what we actually did.
Correct.
Okay, so it has nothing to do with what we're going to do in the next budget. So it's almost two different questions.
But if in the supplemental budget, you spent a lot more money than what you anticipated, it would have an effect on the following year budget. It would have an effect on how much was available.
So it would be hard for us to make any recommendations until we knew what happened in the current year, wouldn't it? We understand that there's an overlap. We don't know what's going to happen to our supplemental budget until period 13.
So the supplemental budgets have to be turned into the state by January. So it
And
has
how do
enough-
you account for period 13 expenditures that may affect that budget?
we have a good grip as to what expenditures have already been spent and create the supplemental to accommodate.
I'll cite, for example, the mini grant last year for the airport.
Mhm.
Okay. And there was confusion around that, but the assumption was we could submit those bills to get reimbursed for the mini grant, those invoices. As it turned out, we could not. And so
We were able to submit them, but the purchases could not happen after the end date. And the purchases were done after the end
We
date.
weren't going to get reimbursed for everything we spent. We thought we were going to spend.
Mhm.
It affected potentially the supplemental budget, which had already been completed. right?
It didn't fall into reference for the airport at all because it had enough funds, it wasn't in trouble. So we didn't do a supplemental on that portion, on that level.
I think we have a lack of understanding of money.
Most of the time, a supplemental budget is done due to revenue that we received that we did not know we were going to receive in the prior year.
That we hadn't anticipated, and expenditures that we've made.
That relate with that revenue, correct?
Okay, so if we projected revenue and it turns out we didn't get it in period 13, after we submitted the supplemental, how do we correct that?
If it was spent at the end, we know we are in contact with each individual department and fund to know what they have spent and what is coming in, what we're to expect. If we, by that time, we know we've closed down, even though there's a period 13, you can't purchase things in period 13.
No, but we purchase, you can purchase things in period 13. You can pay for things in period 13. That's part of the reason we have a period 13. We expended prior to the end of the calendar year, our fiscal year, but the monies either the checks weren't written until period 13, or the revenue wasn't received until period 13. We make that adjustment. But when we had the situation with the airport, where parts of the program hadn't been completed as required, and so our numbers were off on that, based on your understanding of what Sarah Stover had told you about we could go ahead and buy the whatever. But in fact, we could not. We could only submit our request in period 13, but the monies and the deliverables had to have been accomplished by December 31st of 2019. Right?
We had to pay and receive the product. And when Jay ordered, I think at this point it was the gate, if memory serves, he ordered it after.
Correct. And if he had ordered it prior and we received it after, it's still not qualified for reimbursement under the mini grant.
I think we could have probably, as long as we purchased it before, but we didn't even order it till afterwards, was the problem with that.
I understand that happened, but my question was, you said earlier we have to order and receive by a certain date, okay? If we had ordered it in December and didn't receive it till mid-January, what happens then?
The auditors will move it to the next year. You have to have it in hand.
Right. So when it comes to the budget and the supplemental budget, it changes, and we didn't get the money because we didn't meet the grant requirements.
We got the money, it just didn't get that portion reimbursed.
Then we didn't get the money. We didn't get that portion reimbursed.
Okay, this is really getting off topic. Can we go back and talk about our policy?
Well, we were talking about 5.3, supplemental versus projected budget.
Okay, so.
Clarification handles supplemental.
Right, but we just need to clarify this statement within the policy.
Okay, so again, the question that has not been answered yet, does the BOCC under 5.3.3 have to give anything to the administrator in terms of the supplemental budget under this section? Or should the supplemental budget be a separate section?
I'm thinking that we should probably just go ahead and rewrite this as a whole instead of, because it seems to me that there's more issues with this 2017 document than just these highlighted portions. So if we're going to be separating sections like that, then, and because there are some dangerous topics in this policy, I think that maybe we should,
There's what?
Maybe not so dangerous, but I believe that the three commissioners in previous conversations do not agree with a large section of this policy. So maybe it would be best to just get rid of it, unapprove it, and rewrite it.
The whole policy?
I mean, we're going, these are two minor things, and it's kind of being dug into, and showing light that maybe this entire section you would like separated as a whole.
I don't know. But I disagree with the assertion that they're minor, because these are points of confusion that come back to haunt us. And this is a time to make it clear what, under section 5.3, exactly what it is the commissioner should be doing at that point.
So either,
Can I interrupt for just a second?
Yes, Gene, go ahead.
I think this is one of those deals, and I hate sounding like a broken record, but I think this is one of those deals where we need to table this until we can sit down and talk about this in a meeting specifically for, just have a meeting separate from all the other stuff, because this is going to be an ongoing thing. We're almost an hour into this, and we're on like the second question. So,
I agree with you, Gene.
and I don't mind the time, but I think we need to spend the time for a whole meeting and go through this thing and figure out whether it's something we want to just scrap and rewrite the whole thing, or if we want to make the adjustments. And I think it's something we just need to do on a separate meeting schedule.
Okay, part of the issue I have in this, and I'm looking at what Trish put in here as questions or as comments, like under 5.1, she says does not currently, or 5.2 does not currently exist. We took care of that. But then we get down to this 5.3, and 5.33, she has a question and a comment there. I didn't go through and count all of the areas that Trish has concerns or questions, but what would be easier is if in the executive summary on this document that we had listed all of those areas where changes are being proposed or clarification is being requested, rather than have to scroll through here and go back and forth and try to figure out the areas. And she's gone through it and highlighted her areas of concern. And we need to have that source document, but we also need in front of us a summary that might expand a little bit on what her concern actually is. And we also have to have confidence that while 5.3 paragraph was not highlighted, clearly 5.3.3 points back to that opening statement. And there were issues there about, and that's why we're into this an hour, the difference between supplemental and proposed budgets.